Hi, my name's James. Today we're going to talk about prescribing renal replacement therapy, both the settings for the machine and the drugs and bags of fluid that you need to do it. I'm starting here from my critical care work list. Let's open a test patient. I'm going to navigate to my AICU Daily Review tab. If the filter has already been started and you just want to review the settings, a quick way to get to that is within the ICU examination. Look through your left-hand column to find that part. There you should find RRT review. You can also get to this from ad hoc. Scroll down to find critical care, and then select RRT review. Whichever method you choose to use, you'll be presented with the same form. Either I'm going to decide that actually renal replacement therapy can be stopped, or I'm going to review the settings. Because this patient hasn't had renal replacement therapy already started, nothing's pulled through. So let's close this down and show how you would do this for a patient starting on the filter for the first time. Once again, opening my test patient, this time I'm going to go down to Orders on the left-hand menu and add a new order. I'm going to search for continuous or AICU continuous renal replacement therapy, and this will bring up a selection of all of the medication and fluids that you need for renal replacement therapy, as well as a direct link to that form that we were looking at just now. I'm going to select the form and then select the relevant components depending on your local guidelines. It's also worth noting at the bottom of this, there are line locking solutions, something you would put inside a vascular access device in order to prevent it clotting and reduce bacterial infection. In my site, we use Toralock, so I'll select it here. With everything selected that I need, based on my local guidelines, I'm going to go to Orders for Signature. Once we click Sign, the continuous renal replacement therapy form appears. Here, I've already pre-populated the height. Hopefully, that'll be included for your patient. My local guidelines would be for CVVHDF, and a citrate filter is standard. You can see that an ideal body weight has already been calculated. So, let's scroll down to see what values for dialysate and replacement I need to do for a 78 kilo person. 1300 and 800. I can now put those values into the table at the top. I'm also going to set a fluid balance target. Let's say -2 litres. Of course, this can be adjusted as needed, using either the ad hoc or ICU examination to access this form as the clinical situation changes. Finally, the priming fluid. There's some conditional logic that because I've set citrate as the anticoagulation mode, I don't have the option to set an APTTR target. However, I should flag the radio button for the calcium level dose range. Finally, moving to the right-hand side, you can set a CRRT dose. My guidelines would be to select 35. However, it's important to note there is a range for each dose on both the citrate and the non-citrate chart. I would refer you back to your local guidelines though if you need information on what to put here. Similarly, there's information about which fluid bags should be used. With all the information included, it's time to save the form. You may have to click through some interaction checking errors. That's to do with these medications or fluids not being able to be checked against a drug allergy status, which in this case is not relevant. I can see that there's an issue with the calcium prescription, indicated by this blue and white cross. Let's open the order and see what that is. It seems that the weight has not been set for this patient. Often this will have been set, but for a test patient I'm going to need to enter this myself. You might also find for new admissions that this will be the case. With that entered, everything looks good, so we can go ahead and click Sign. If I want to see the prescription for the filter, I can go to the Structured Notes, where the renal replacement therapy form will have generated a structured note. Remember that renal replacement therapy settings should be adjusted regularly, and noting those reviews using either ICU examination, see RRT review, or accessing the form via ad hoc to create a standardized way to document your decision making.